Hello, everybody. I'm Reasa Currier. I'm the Vice President of External Affairs at the Humane Rescue Alliance. And unfortunately, our CEO, Lisa LaFontaine, had a medical emergency with one of her pets come up. So she is not going to be able to join us this evening. And she's sorry to miss this opportunity to connect with you all. So you're stuck with me this evening. And also, we're going to be joined here with Mark Cushing. He is the founder and CEO of the Animal Policy Group. He's a longtime political strategist, a government regulatory advisor, a corporate executive, and a former litigator. But we're here to talk to him about his incredible book. This recently came out, Pet Nation, and it's the love affair that changed America. So welcome, Mark. Thanks so much for joining us.
Thanks, Reasa. Look forward to the questions. You got a great organization, so put me to the test.
Well, you wanted to talk a little bit first, and I think tell everybody about some of the work that you do beyond being an author and some of the clients that you have and your work in animal welfare.
Happy to do so. So the book Pet Nation, which comes out in paperback September 21, so you can save some money. And I've slightly changed the cover so it doesn't have that cute white chihuahua on the front. But it was published by Penguin Random House, and they wanted an insider's account of really what's changed dramatically, like order of magnitude change with pets and their relationship to American culture, American society, American families, and so forth. And I qualify for that. I guess it was an interesting project, obviously, because the work I do with the Animal Policy Group, which began when I was a partner at the Sonnenschein firm in DC back in 2005 and 6, and there was an issue that required a congressional solution, not a law, but as you know from your days on the Hill, the appropriations subcommittees do reports that accompany their appropriations that they serve up to the full committee. And I got language in that addressed the issue of microchipping of pets. It was a lot of fun and fortunately had a great result, which I thought was the only time I do something in the pet world professionally. And 16 years later, I have a 9-person group, the Animal Policy Group, and we're the only independent group in the country that works exclusively on pet, animal health, veterinary, and animal welfare related issues. And I basically represent, no reason not to share this, the corporate and the larger scale side of the industry. So I do a lot of work with vet schools. I have anywhere from 5 to 10 veterinary college clients. I represent the Mars Veterinary Health, which is the biggest group of veterinary practices in the country, Zoetis, which is the largest pet pharmaceutical, Royal Canin and PetSmart, and a variety of sort of larger scale interests. So that may cause half your audience to find something else to watch, but it's given me a front row seat on most issues that animal welfare groups, animal rights organizations have been involved in, many of which we're aligned on, some not. But it's been a fun ride, and it's given me a chance to be full-time in a very cool and now extremely popular surging industry that has to do with pets. So good to be here. And any questions you want to start with will be good.
Okay. Well, thank you, Mark. And I think what's so interesting about your book is your diversity of experience really shines through. It's very data driven, and so I think it's incredibly informative for someone like me that works in animal welfare. But I think if you're somebody that loves animals and shares your home with the animals, it's also a really fascinating book just on the evolution of pets in the household. And so that brings me to my first question. One of the great affirmations of this last year going through COVID is that pets really are family. And when everything started shutting down and the pandemic began really impacting so many families, we were bracing, as were all of our colleagues around the country, for an influx of animals. And we were surprised that those animals never came. We had a few animals come in related to COVID, but we had them briefly, and most people were able to come reclaim them or find family members to help. And so we were really touched that despite economic and medical challenges, our community did hang on to their pets. And I think most of us feel that our pets are family members, but this hasn't always been the case. And part of your book is you talk about the evolution of pets, how in many ways, pets were considered chattel, their property, but then over the years, they've just taken on a whole new status. Could you speak to some of the societal forces that contribute to that change?
Happy to, and with respect to COVID, my paperback, by the way, I added a section dealing with COVID and pets, but pets remain under the common law, which obviously goes back to medieval England. And I should footnote, I majored in medieval and Renaissance history at Stanford. So, I know how to pick a dynamic career, right? But common law definition of animals is that they're property, personal property, and they remain that, which people find to some extent an odd or sort of an alien idea, but it's been crucial for access to pets and pet care that be the case. So I've been on the side defending that because it's insulated the world of pets from the lawsuits and the sort of unlimited damages awards that human medicine has faced, which would have a direct impact on cost of veterinary care and so forth. So that's kind of an interesting story. And we should spend maybe some time in the hour debating that or discussing it because people have different opinions. But the greatest success story in American cultural history, in my view, is the American cat. Cats came over on ships from Europe as sanitary workers. They had a job to kill mice and rats so they didn't eat the food of the sailors and the crew. They got to the US and the East Coast cities, Baltimore, New York, Boston, Midwest cities, kept them on in that role in the 1800s, in the early 1900s, even as sanitary workers, getting rid of mice and rats on the streets and in the houses. Okay. And then as a reward for that great sanitary work effort, they basically declared cats to be the new form of rodent once public health departments were formed, and cats were euthanized by the millions. It was basically, they had no value now. And yes, some people had pets, but that was usually quirky people in the neighborhood or very wealthy Europeans. And now you jump ahead to 2021, 100 plus years later, and cats are royalty again. There's essentially the same number of pet cats as dogs in the country. And the great phrase is, dogs have owners and cats have staff. I mean, cats, if anybody has a cat watching this, you know what that means. I mean, cats run us, they manage us for their benefit. So very interesting. But the key to all that was in the former labor context, and dogs were laborers too for farmers, and cats were, as I described, you had no sense of what we've now known to be the human-animal bond. And that engagement with an animal, but particularly with a pet, has a medical and physical effect in your system, in your brain. Your oxytocin level goes up, which is a source of joy and relaxation and happiness, if you will, simple term. And your cortisol level goes down, Reasa, which is the source of anxiety, stress, worry, all the things that make life less than fun. And it's like an elixir. I mean, once people experience that, which required being close to a pet, and it really was triggered by when pets about 25 years ago came inside and spent most of their day and all their night inside and not on some little bed next to the family bed, but on the bed. Now 75% of pets sleep on top of the bed of their owners. Extraordinary figure. And people got close to pets, right? And they didn't go get a book out of the library on human-animal bond and read it and say, I think I'll go get a pet. They just experienced what engagement with a pet does for you. And, the story unfolded, and we can talk about that, but that was sort of the change that is about 25 years in the making. And now everybody sees it, everybody knows it. Pets replaced babies as the most popular items in social media. I mean, I don't care where you live. When you go to Facebook, you go to Instagram, you'll see at least as many pets, but probably more pets than children. And people can't get enough of it. Everybody's their own film editor. Everybody's creating their own cat video and dog video. So it's interesting, to be sure.
Well, our CEO, Lisa, always says that social media was created for pets. It is just the place to showcase your animal. And it's also something that we have witnessed over the last year, is that it's a place where pet lovers and pet owners can really create this community online. Of course, we've always witnessed that in person. How many times I've crossed the street to just pet a dog, and then I strike up a conversation with the owner and we discover we have things in common. I mean, most of my friend group, they're fellow pet people. And it's just, that's always been such a big part of the Humane Rescue Alliance community. Our volunteers have this wonderful network with each other because of their shared values of loving pets. But what we witnessed over this last year is that when we made the decision early in the pandemic to move most of our adoptable animal population into foster homes to create social distancing for our staff, and we were met with this influx. We had almost 2,000 people reply and say they want to foster. And what we witnessed is this virtual community create, because we had the experienced fosters take all these new fosters under their wings, and it just, this beautiful, rich community emerged on social media of people lending, resources and expertise to each other. So I'd love it if you could talk about pets as social lubricants and how they, in person and digitally, can create community.
I'm not surprised by HRA's experience, and it's there's twin elements of the human-animal bond. One are the individual benefits. A person, it could be an autistic child, it could be a senior in a nursing home. I mean, in any range of people, their situation medically, mentally, emotionally can be improved by being connected to in some fashion a pet. But the twin element is the social capital of pets. And there's been less written about that. And obviously I spent quite a bit of time on that in my book. And there's an interesting study I'll share, and then we'll talk about the particulars here in the States. But in Perth in Western Australia, they did a study, and it was a blind study in the sense that 3 neighborhoods, they looked at what's the factor that has the most impact on building community. What's community? Lack of fear, trust of neighbor, knowing your neighbor, reduced anxiety, engagement politically and culturally and in the community life. Basically what we like about, maybe what we remember about our college dorm, people seem to be there and getting along well. And studying sports teams, church, schools, politics, all the other ways people engage outside their home, the winner was pets. And everybody was surprised by it. I remember sitting in Portland, Oregon, where I lived at the time, about 2008 or 9, with the authors of that study. And I heard that. And at first, I was incredulous, and then I thought about it and went, wait a second, there's something else going on here then. So we replicated the study in San Diego, Portland, Oregon, and Nashville, and same results. And Nashville, we think of it as this hip music town, but in truth, it's in the Bible Belt. It's right smack in the middle of Tennessee. And even more than church, even more than religion, pets were a unifying factor. So, I look at that, given the way the U.S. is set up right now politically, and there's just a little bit of a divide between the left and the right, as in the Grand Canyon divide. And I can't think of better medicine for this country than pets. And I've promoted, which to some people makes them fall out of their chair, the idea that we should double the population of pets in the country. Reason being that if pets do what they do for people individually, in tough circumstances and regular day-to-day circumstances, and it's the best glue or the best form of social capital to build communities, why wouldn't we want pets to be more part of our lives? And that gets at the issue that I know you all work hard at, which is removing barriers to pet ownership, because there's still significant barriers out there. But in truth, I don't want to, it's not Franklin Roosevelt, a chicken in every pot, a pet in every house. You can't make people have a pet. But you can certainly make it possible, and that's possible financially, possible in terms of where you live, possible how you work. There's key ways that if you go back 25 years, Reasa, in this country, the answer was no. no, you can't bring a pet into a hotel. What are you talking about? You couldn't even get to the counter, that you'd be met in the lobby saying outside. If you got to the lobby or to the counter and wanted to check in and they looked and they saw a dog in your arm, it'd be like gone. Now, and I love this because of your DC base, I spent a lot of time in Washington when I lived there, obviously, but also traveling before COVID. And DC has, I think, 14 Kimpton hotels.
Yeah.
Some of my favorite, the Rouge, the old post office. I mean, just some wonderful hotels. And who could have imagined just 20 years ago, Kimpton hotels have a floor set aside for non-pet owners. Now, if you told me 20 years ago that we would reach a point where pets essentially ruled the hotel, but we will carve out a special floor for non-pet owners, I would have said not a chance. They'll never have that status here, but that's how far we've come. And Kimpton did that because they know that travelers, even if it's not their pet, you walk into a lobby and you see a fun dog, a cute dog, it looks at you, lets you pet it, whatever, you feel better. You're glad to be there. And it's sort of all the fears that went behind the prior regime are pretty much gone now. You still have people that don't love pets. That's okay. They shouldn't be forced to feel otherwise, but it's been really interesting. And that social capital piece, I think, since I'm talking to a Washington-based audience or a Mid-Atlantic-based audience, I have used that as a lobbyist for now 10 years running. When I have a conversation about pet policy with any politician in any state or member of Congress, I start talking about the human-animal bond. And 10 years ago, I'd get this dull look in my face, like, what are you talking about? Pets are pets. But inevitably, the member would go, but let me show you this. Let me show you my dog.
Yeah.
And then they show them the little puppy, the big smile on their face. Politicians, in the middle of a workday in Capitol Hill aren't always smiling for good reason. And they can't stop talking about it. And I would always say, remember, all due respect, you just gave me exhibit A to what's called the human animal bond. You happy now telling me that story? Of course you're happy. You should be. And if you get them to understand that there's real gravitas to the human animal bond, to the relationship we have, both socially as well as individually, then policy should reflect that. And one of the things, since I have the microphone, we're going to begin to push in partnership with the Human Animal Bond Research Institute, which is based in DC. And it's a client of mine, and Steve Feldman and Lindsay do a great job. We're going to begin to push the idea, which will seem heretical at the front end, but just think about it. We place good nutrition, alcoholism treatment, weight loss, exercise, non-stopping smoking as these wellness activities. And we line them up, and the federal government, through incentives, through direct tax credits, or through other just direct spending, incentivizes billions of dollars to Americans to engage in that behavior. Good idea. We all like those programs. It reduces medical care and medical costs. So all that sounds good. Ownership and care of a pet, in my view, should be at the same level. Unless you can disprove the human animal bond and disprove the social capital, it's the cheapest medicine the US could have, and people would respond to it. Now, when I first broached the idea, again, people would laugh and go, "You're not serious, right?" I'm dead serious. Why wouldn't you? And think of the examples in your life of people that have a pet. Because of that, they walk every day, right? Because of that, they're more conscientious. They, just everything about it. And so, we tested doctors. 90% said they'd write a prescription for pet ownership. That's a nice idea, but so it leads a lot of places that we could discuss, but it goes back to just that basic human animal bond and social glue, to use your term, that pets engineer and promote. So it's an idea whose time has come.
Well, and it's been a profound example the last year. I think when many people have been isolated from friends and family, that pet has been just essential to the mental and emotional health of so many individuals. I mean, now we know most adults live alone. And we see this especially with senior isolation. I know there's a lot of interest right now in combating senior social isolation and loneliness. And loneliness is not just an emotion. It can have devastating impacts on one's physical health. And I think for us, it's, one of our core beliefs at HRA is that everyone deserves the love and companionship of sharing their life with a pet. But then we run into all these barriers that you mentioned. It's affordable housing is a huge issue for us. I mean, we are in one of the most expensive rental markets in the country. And so we've seen this huge disparity happen where, pets are a luxury amenity like a fitness center, and only those who can afford to pay for that amenity have access to it. So low income, affordable housing, it's really difficult. And the other barrier, of course, which you talk about the housing piece, but then you also talk about access to veterinary medical care. And I mean, we're not even just talking about emergency care, expensive care, we're talking about basic wellness.
Right.
And, with a nationwide shortage of veterinarians, I think this is a solution that's going to require industry partners, the government. It's not something that we as, organizations that shelter animals can solve on our own. So what is your suggestion there?
I probably spend half my time for the clients I have on the veterinary shortage and the veterinary nurse or vet tech shortage, also the dog shortage, which we can talk about in a minute. But I want to go back to the housing issue for a second because of the role that Washington plays in this. Put aside millennials now, in all the new apartments, near when I lived on East Street and 7th, so that just the miles now, it seems like of trendy, cool apartments and condos for people that work in the Hill or work for agencies or in the private sector, right? Developers figured out pretty quickly millennials demand at least the right to have a pet, and they could afford it. So they would charge the fees they charge and people could have pets. The tragedy is public housing law in this country for public financed housing for low-income Americans and low-income senior Americans require a pet-friendly posture. I've done a study, my team has done studies. They have called low-income Section 8 housing developments and asked the question, simulating someone that might want to become a tenant there, and been told, no, you can't have a pet. And nobody enforces it. The state of New Jersey has a law, it's been on the books since 1996, that says all senior housing, privately financed or publicly financed, all senior housing must be pet friendly. We couldn't find one person in the government of New Jersey that even knew that law existed, let alone enforced it. So I've talked to heads of public housing. I'll leave the city anonymous, but she was in charge in a major city, a top 25 city. I said, do you enforce and do you make your low-income public housing pet friendly? No, don't. Have you tried to? Are you in any way motivated to? No, we have other priorities. And it was dispiriting, but I can't say that I was surprised. So that's a huge issue. Now, if you go to the shortage of veterinarians, there's two solutions, and both are in process. One's slower and longer term, and one is quicker. The longer term one is more vet schools and larger classes. We have 180 or so medical schools in the country. We have 32 vet schools. And for many years, up until 2000, we only had 28. So you had this pet population surging, growing at a much faster rate than human growth population in the US, and nothing catching up. Well, that's now there's 4 more vet schools, a couple of which I was the consultant to get started. But it takes time to start a new vet school, but you can increase classes. And accreditors, frankly, have been slow and reluctant to allow schools to grow. And you have right now, at any given day, 7,000 openings for veterinarians in the country. And you go to any practice in the country, rural, suburban, go to Bethesda, go to the Eastern Shore of Maryland, I don't care where you go. What's your number one problem? I can't find a vet. I can't find anybody to come help me. But the bigger problem and the solution, besides growing schools, is if you look at human medicine, take high school, your high school graduation is the starting point. There's this ladder, there's about 10 steps, 2-year community college degree RNs, 4-year bachelors, 5-year master's nurse practitioners, doctoral nurse practitioners, physician assistants, right? DOs, MDs, and then fellows, of course, beyond that. So human medicine has created, responding to the shortage, which still exists of human, quote, doctors and healthcare professionals, it has created this sort of range of specialties. And if you don't have the interest or the time or the money to go all the way through to be an MD, you had all these places along the way who also pay now living good wages. You know, nurses make so much more than they made 10 years ago. Now let's go to veterinary medicine. We have 2 ladders, 2-year community college degree, vet tech. In some states, it's licensed vet tech or certified vet tech or registered vet tech. Okay. And they take a national board exam. Then you jump to the DVM, a doctoral degree 4 years after college, nothing in the middle. And you know who opposes anything in the middle? The veterinary establishment. Why?
Yeah.
Because like doctors 30 years ago, they thought their world was going to end if nurse practitioners, if PAs, if DOs arrived on the scene. Oh my God, you know, I'll be on the street. The answer is really, you know, we have massive shortages of each. And so what we're working on now is developing a master's program through vet schools, supervised by veterinarians, that would be, without calling it a veterinary nurse practitioner or veterinary PA, it'd be the same thing. And the response, Reasa, I can tell you around the country, because I've sort of shopped it to people, has been cartwheels. It's like, exactly, that's what I need. And so that's somebody now, instead of a vet tech making 32 or 35,000 a year, which you can't make it in greater DC at that level. You're at the 60, 65, 70, 75,000. It's now a career path. You've got real responsibilities. And it's part of a solution, but I think the first school, Lincoln Memorial University in East Tennessee, their vet school will launch this in January, and it's going to be online, so you don't have to leave. You could be in Seattle working at a vet practice, do your clinical there, and get the degree. And I think it's going to be a game changer, and that's the fastest way to get a new professional that can help. And all we have to do is look what happened in human medicine, say, let's just do that as efficiently as we can. And I think that's going to make a big difference. The other policy issue that I'm very involved in, that's making quite a bit of progress right now, is telemedicine. And the example I always use, I always say Bethesda. I said, picture a senior woman living by herself on the 8th floor with her cat, and the cat's the most important being in her life. You think she's going to go under the bed, pull the cat out, put the cat in a crate, go to the elevator, go down 8 floors, walk to get on a bus, make 2 connections, and go to a vet clinic? The answer is 0. There's no chance of that. Now, put her on the phone. She's probably got a laptop. Either way, put her on FaceTime with, you're the doctor, and let her talk to you, let her talk to your staff, and get all sorts of guidance, such as, hey, don't share your human meal with your cat who looks like she weighs 22 pounds, and you're now yourself 12 pounds underweight and need to be nourished, and all sorts of advice you can give. And by the way, if you need to bring the cat in for some procedure, why not pick her up? Why not go help that happen? So those models are beginning to, move or morph from human medicine into veterinary. But guess who fights it? The establishment. The establishment fears that somehow we'll lose money if people don't come in, they do telemedicine. The truth is, you can charge for it. That woman will pay you for the good advice she gets. When I was a lawyer at partner in a law firm, I didn't make phone calls for free.
Right.
That's not how it worked. And people assumed I had some expertise, and they're, willing to pay for it. So those are big changes, and they've got tailwind behind them right now, thankfully, Reasa. So there's headwinds, typically old guard, but if you look at the legal profession, medical, dental, the establishment always fights it. They're doing just fine with no change. So don't make me change what I do. Don't create a new professional to compete with. And I think the lens that sees that happening will be refined, hopefully, over the next few years. And we'll see, we'll always have a shortage. I mean, in truth, pets aren't a fad. They're people that, millennials that had one pet during COVID, what'd they do? They got a second pet. They realized
Right.
their cat needed a playmate. Their dog wanted
Right.
someone to play with, and so we did a survey of the 44% of American households that have dogs. And this was a 1,500 person sample done by a firm that does presidential polling. So it was a true random sample. So 44% of American households have dogs. Of that group, 43% have more than one dog. And a surprising number have 3 dogs. So people have discovered that they like to play with each other. And maybe when you go back to work, life's better for that cat or dog if they have someone to hang with. Even if they're sleeping all day, they can sleep next to each other and so on and so forth. So, I think we're going to get the demand for services is not going to slow down, but we can catch up some. And hopefully what I just described will become in 3 or 4 years, if we talk again, we'll have real progress to show for it.
Well, we are right there with you, Mark. If you need partners in that fight,
Yes.
it's something that's
Yes.
so important to us. We've leaned heavily on telemedicine during COVID, especially with all of our animals moving into foster and just being able to do that quick video connection. It is just amazing how much you can diagnose through that process and how much support you can provide. And when we have fosters living in all areas of the, DC metro area and also individuals that have ability issues. So maybe getting in their car and coming into the shelter doesn't make sense. And so we just see huge applications.
Well, I'll take you up on that. And I know you've recently added a New Jersey arm to your work. Well, guess what? New Jersey's Veterinary Medical Board, and many veterinarians weren't happy with it, just passed the pro telemedicine set of regulations. And I'll reach out to you all. Seriously, we need partners. A year ago, with a colleague, I co-founded the Veterinary Virtual Care Association, which is the veterinary version of the American Telemedicine Association, which is headquartered in DC and has been a powerhouse for 30 years. We've got that now in the veterinary space. And a former person that worked for me is running that organization now. But we need partners, and it's overcoming skeptics that somehow think if you're a good veterinarian on Tuesday, well-trained, ethical, compassionate, somehow if you wake up Wednesday and are given telemedicine tools, you turn into a malpractice machine and you're just making bad decisions left and right. We have to protect you from ourselves. And so we sent out questions to all state boards that liberalized laws during COVID, also to Ontario, which is Toronto's province in Canada, 15 million, big province, and said, has there been a single complaint filed with the regulatory board that any pet was harmed by the use of telemedicine? Zero, not any. So you can scare people all you want about what might happen. The truth is, if you're a vet and you're on a Zoom call like this with me, if you don't have enough information talking to me and looking at my cat or dog, guess what? You can say to me, Mark, tell you what, bring your pet in. And what am I going to say? Well, the hell with you. The answer is great. When can you see me? Now, sadly, right now, the answer might be in 3 weeks, or it might be for some special.
Yeah. Oh, yeah.
It's 3 or 4 months, but we're going to win. I mean, ultimately, cultural forces, as you know, living in DC, and social forces overcome interest group lobbying and interest group opposition. I mean, and so we'll be at a point in our lives where telemedicine is ubiquitous in veterinary medicine as it is in human medicine, but we're not quite there yet.
Well, that's incredibly exciting and one of the most hopeful things I've heard in a while. So yeah, we're on board.
All right.
So one of the other things you talk about in your book is the looming dog shortage. And so for those of you who are familiar with our organization, one of the programs that we run out of New Jersey is our Waystation program, and it's one of the largest. It's really the preeminent program in terms of transporting animals. It's an international program. So we transport animals primarily from the southeastern part of the United States all the way up into New England and Canada. And so we move dogs and, so we have a situation in New England where many of our destination shelters have a shortage of dogs. And then, the source shelters in the Southeast part of the United States, including right now, they have puppies coming out of their ears. They have too many puppies. So So for us, we know there's a disparity there, and so moving animals is something we do, but we also know that's not a long term. That's trying to treat a symptom.
Right.
So what is going on with this shortage?
And this is a great question, and it's chapter 5 of my book, and the term I use is a canine freedom train, and that's what the northern shelters. Denver Dumfries League in Denver, the Oregon Humane Society. I used to joke that in the eastern half of the country, above the Mason-Dixon line, all the dogs have a drawl, and on the western side, all the dogs speak Spanish, because the Oregon Humane, it's not offering strays from Portland. That problem is not even large enough to be described, but they're from LA County Animal Control and Bakersfield, and Young Williams in Knoxville sends dogs to New York, and Mississippi shelters send dogs to Minneapolis. And there's these great relationships, and you have, as I say, one of the premier networks, and it surprises people. I used to have people look at me and go, "That doesn't sound right." I said, "What do you mean?" Ask any of those dogs. The choice was euthanasia or going to a nice home, in Bethesda, and I think they'll take the latter every time. And it's efficient. And there are shelters in the South and the lower Midwest and Texas that are overpopulated and don't have any resources. But we've reached a point where that is not a sustainable source of supply. So in August of 2019, for me, very conveniently, 3 weeks before my manuscript was due for the book, the CDC came out with the numbers that I've been wondering about for years, namely that over 1 million, not quite 1.1 million dogs a year come into the US from foreign sources. Less than 3% of those dogs have any health records, any vaccination or veterinary records. And believe me, they're not all walking through customs, okay? They're getting into the States, in some cases by some very bad actors, in many cases by rescue groups, just a variety of ways they're getting into the US. And it's great for those dogs that they found a home in America. So I don't obviously wish them anything but a good long life. But for a country that loves dogs and all the things we've talked about so far, that's not a sustainable long-term plan. So there's 2 options. Well, there's 3 options. One, completely unacceptable, but we're on that path. The unacceptable option is dogs become a luxury item. Okay. The price right now of a golden doodle puppy in the US is between $4,500 and $5,000. Okay. That's completely beyond the reach of most of Americans to think about doing that. Okay. So if you don't want dogs to be a luxury supply, and here's what's cool. In 2015, when we did the survey of Americans and households that had dogs, Americans with annual incomes of $30,000 or less own dogs at the same rate as $100,000 income and more. So we haven't had that income disparity, but we're heading there. So you have 2 choices. You either get comfortable with foreign sourcing, and then you have to do something about that. You're going to have to go to some pretty rough neighborhoods. I don't want to make anybody mad in the audience, but the country shipping us dogs, it's not England, it's not France, it's not Belgium. They're rough places as far as their animal welfare practices. If we want that to be our long-term source, then we have an obligation to go to those countries and say, we'll make you a deal. You can have an industry here if you want, but here are the humane animal welfare policies you need to follow. You know what their answer is going to be? Not a chance. We're not doing that. And we've tried that in Asia, and it hasn't been successful. So the solution has to be taking the stigma off of commercial breeding in the US. Now, everybody watching, in their mind, a bubble just popped up called puppy mill. For the record, just so it's clear, I'm not advocating for, I don't represent, and I'm not promoting puppy mills. But you could be a large-scale breeder and do it humanely. You can be a hobby breeder in Southern Maryland and be a puppy mill. In other words, size alone doesn't determine whether the cleanliness, the veterinary care is appropriate and proper. So there are groups now forming basically to negotiate a peace agreement. And it'll take a lot of work. It may be as difficult as a Middle East peace agreement. I'm not kidding, because the passions and mistrust is that deep. But there has been a comprehensive blue chip set of standards developed that you have to have hours to read because it's so detailed by Purdue animal welfare Professor Candace Croney at the Purdue College of Veterinary Medicine in Indiana. And you don't need to improve on her body of work. It is an extensive, and it's challenging. I mean, a breeder has to up their game. But this is what the coffee industry did. I grew up in the Northwest, of the Starbucks in Stumptown. I'm drinking a nice Stumptown cold brew. Probably shouldn't drink that middle of the day, but you do what you do. In any event, I can remember when coffee bars were under extreme political pressure because of labor and environmental conditions in the countries where we source beans. Again, pretty rough neighborhoods. Maybe Costa Rica is an exception, but some fairly tough parts of the world. And they created a certification process. It was called Fair Trade. They gave it a nice label, and they certified sources. When's the last time you heard any dispute about the labor practices when you got a cup of coffee or a latte at Starbucks? It's 20 years. They solved it. That's doable here. If you certify standards, then have an independent auditor, not the breeders themselves, but an independent auditor, Reasa, that can come in and certify that you've got an operation in conformance with the standards. Then you can put a nice label, like a Purdue label, whatever you want it to be, on the website with the dog. And now you can begin to trust it. And you don't have to just make special designer dogs and puppies, right? I think you can have mutts and mixed breeds that are affordable. I mean, the future isn't healthy $5,000 to $7,500 puppies. The future is high-end puppies for those that want that, and affordable puppies for those that can't afford it or don't want that. And it's a domestic industry. It could be a great industry, but here's the problem. I have never met a parent that told their daughter, who was 17, honey, I want you to go get an ag degree and become a dog breeder. That's a good way not to get invited to any graduation parties and have everybody just shun you that, my God, Reasa is going to grow up and run puppy mills. So the language of puppy mills, wickedly effective politically, congratulations, but it stigmatized the whole notion of breeding of dogs in the US. And ultimately, if you don't like the foreign sourcing, that's going to have to be a solution. And I think we're going to get there, but it's going to be bumpy, as political negotiations are. They're going to be bad actors that people worry about, and you know, it's not something that happens overnight, but that solution is going to have to be the case.
Well, and it's tricky, as you said. I mean, you know, so for those who aren't familiar with what puppy mills are, what Mark was describing, puppy mills are described as inhumane, high volume dog breeding operations. And so it's something, you know, when I was working at HSUS, obviously it was a big priority campaign for us in combating puppy mills. And, you know, I've seen the struggle of consumers, especially this past year. There's a huge surge in people wanting to add dogs to their family. And there, you know, many shelters were out of dogs and struggling to meet the demand, and people got tired of waiting. And I cannot tell you how many friends and neighbors I had send me websites and say, how does this look? I'm looking at getting a golden doodle here. And, you know, even as somebody that this is my industry, there's just no labeling, right? So when I can, you know, if you want to go buy eggs, you can get cage free, you can get humane certified, you get free range, but you don't have any of those labels when it comes to dogs. So, and they are very good at marketing. So there could be cute pictures on the website, and my counsel has always been, you need to go, you need to see the parent dogs, you have to see where the dogs are raised, you have to see the medical records, and it's just that puts the onus on the consumer, which I think is unfair. And so there does need to be this relationship. The industry needs to figure it out. And the other thing we're supporting is on the federal level is the Puppy Protection Act, and that really creates a framework to improve the regulatory oversight process over this industry. Just, you know, some baseline access to medical care and
here's my view of that. I understand that, and I think that makes sense. But industries that don't regulate themselves invite government to step in, and we have many, many examples of that. When industries do take care of issues, there's less pressure on government. It doesn't mean you can't have a fallback, but I think to really be successful in the marketplace, if we can get industry and the animal welfare community together on agreeing on the standards and agreeing on an independent auditing process, that's the best solution. It won't be to have USDA seek more and more funding to send inspectors around the country. That won't be necessary if industry takes the steps. There's good reason to be skeptical about the ability of the two sides to negotiate a deal. That's always the case, but I just saw that there's an infrastructure agreement this afternoon that was reached between the president and members of both the Republican and Democrat caucus in the Senate. So you can reach agreements on tough issues. And I think that's the best path forward to find, number one, a set of standards that people say, these are humane, they get the job done. And then number two, an independent firm that gets full access to the breeders to see the operation and to get access to the records and give them instructions if they fell short and say, come back next year or come back once you fix this problem. But I think you can work that out. A lot of industries have done that in every facet of our consumer life in the US. And ultimately, there's no reason that the dog breeding world can't get online.
I don't see Reasa back, but I think it's about 15 minutes before 6. So it might be a good opportunity to open up to any questions, if that's all right with you. Okay.
You just tell me the question.
Yes, I will. We do have one that's already in queue, but if anyone else has any other questions, please feel free to use the Q&A at the bottom of your screen and just type those in, and we will get those to Mark. So the first question is about emotional support animals. Emotional support animals specifically on airlines, and what your thoughts are about kind of the current ban on that, and maybe how we can mitigate that.
Yeah, I'm disappointed, and I was surprised during COVID that happened, and a lot of work has to get done. So that's an astute question. I travel with, we have a Papillon puppy who's standing on top of a chair right now, surveying the universe to see what he needs to go attack. But in any event, we travel with him. And, I think people understand the rules now, the staff do, and I think that's an overreaction. Has there been, the thing we always hear about is the alligator that somebody in Pennsylvania called an emotional support animal. And yes, as opposed to a service animal where there's a distinct process, ESA you can get an emotional support animal certificate online from someone of dubious credentials, and there's reasons to be skeptical. Again, you can stipulate what you require by way of emotional support animal documentation, raise the bar if you need to, seriously, raise the bar if you need to, and let people take advantage of that. And it defies the tailwinds of history right now to tell people you can't travel with pets. So I'll be involved in some manner in trying to pull those regulations back, but that's unfortunate at this stage.
Yeah. We have another question. So in the title of the book, the economic impact of pets is mentioned. As a government employee working for a statistical agency, what data sources do you rely on? Is there anything missing that you would like to see?
Well, yes. First of all, I would love to see the Department of Commerce, which oversees the Census Bureau. I'd love to have a standard pet question in the household in every census. And people might be surprised to hear there haven't been. There have been geographic studies done by the Census Bureau, but we don't have a pet question. Now, to add a question, you often have to bump another question. I understand everybody wants to know everything about consumer behavior and political and other issues in the census, but number one, that would be great progress. Just simply to have a Census Bureau confirmation of the number of pets. We have surveys, we have data, but this has not been a data-rich profession, the profession of veterinary or animal healthcare or animal welfare. So we have some data, but not enough. And that's a great question. And it would be great, for example, for Congress and whichever appropriation committee has HUD in its jurisdiction, to have HUD account for the policies of all Section 8 or public housing in the country as to whether or not it's pet friendly as it's required to be. And I'd like to see somebody push for that. I don't think anybody wakes up in the morning at HUD and thinks that's their job, and it should be somebody's job. So that would be another piece of data to really understand just how serious the barrier is for seniors and low-income Americans to be able to bring their pet into an apartment if it's publicly financed. That alone would be a great achievement. The data about the private or industry and economic side of the pet world is developing all the time, and there's more and more good data there. It's not at the level of human healthcare, but I'm impressed where we are there.
Wonderful. That is all the questions that we have right now, unless anyone has anything else they would like to submit. I'll turn my video on so you're not talking to a ghost, but Mark, thank you so much for joining us. We really appreciate your time today. Sorry, Reasa lost connection. Technology is
understood.
Yes.
Well,
so thank you so much, Mark. We really appreciate it. Yeah.
Enjoy the Washington summer, and we'll talk again, I hope. Thanks for having me.
Thank you, Mark.
Bye-bye.
Bye-bye.